Facilitating interprofessional education can be challenging for various reasons. The logistics in gathering large numbers of students from across disciplines involves coordinating schedules, funding, and administrative oversight. However, even if you cannot provide a fully integrated interprofessional education program, using brief modules and training workshops can begin to lay a foundation that interprofessional collaboration is built upon. The following slides will provide suggestions to help you incorporate interprofessional education into your curriculum. Specific class activities or assignments can be geared towards building interprofessional competencies. Dr. Shelley Cohen Conrad, the director of the Interprofessional Educational Collaborative at the University of New England, recently presented pedagogical tools that can be useful in bridging the divide across professions. Using an interprofessional case conference, where students share a case or research article, can help to bring in more diverse professional perspectives. Additionally, using reflective journals with specific interprofessional prompts can promote students' self-reflection about their practice experiences. Shared didactics is another tool where students learn about a topic within an interprofessional group. It is critical that the interprofessional educators model communication and teamwork. Shared assignments within an interprofessional group can also be used to encourage learning from multi-level and interdisciplinary perspectives, as well as building collaborative working skills. Within the clinical setting, Dr. Cohen Conrad suggests using job shadowing. Being paired with a professional will allow students to observe their daily roles and responsibilities. Also, using shared patient panels, where students are paired in intentional interprofessional teams to work with a preceptor or supervisor. Here, students will share assignments, common patients, and supervision with an IPE trained supervisor. Finally, helping students to join interprofessional teams providing home visits. Students gain an understanding of the lived experience of their patients, fostering empathy and a person-centered perspective. Wherever your course or curriculum is within the range of options for interprofessional education, there are certain characteristics that are helpful. In this brief TEDx video, Joy Dahl, occupational therapist, shares her experience in building an interprofessional curriculum and the lessons she has learned along the way.
How many of you heard that healthcare in the United States is ineffective, inefficient, and very expensive? Raise your hands. Okay, so it's no secret that we need to make changes in our healthcare system. Today I'm going to tell you the story of how I became an accidental expert in helping to change healthcare. And it was a total Alice in Wonderland experience. I don't necessarily know, nor now know what I'm doing, but I've learned a lot that I hope today I can leave you with some lessons that you can use to think about cultivating collaboration both in healthcare and in your own life. So a few years ago, I was put in a room with a group of strangers who are now my close colleagues, and we were told to design an interprofessional collaborative care model at a new clinic that was opening. Interprofessional collaborative care is where healthcare providers intentionally work together to be all on the same page with patients and families to deliver care. For those of you outside of healthcare, it might sound strange that we don't work together, but it's not really our norm to be that collaborative, and I'll talk a little bit about why in a couple minutes. When we started this journey, there's no roadmap for what we were doing. We literally had to create and innovate to figure out the best ways to deliver care and figure out how we would do it in a system where that presents a lot of challenges. So today what I'm going to do is talk a little bit about some of those challenges and then give you 6 lessons that I think you can take in your life to hopefully move change forward in a positive way. So the Institute for Healthcare Improvement has identified 3 ways in which we need to change our healthcare system to improve delivery of care. One is to address population health. Our healthcare system is really good at doing acute care when people have an accident or an injury or a flare up in a disease. But the reality is lots of our patients have chronic disease, and we need to get better at managing that and keeping people healthy. In addition to that, we need to improve the experience of care. And whether you're a healthcare provider or not, our one unified experiences at some time of our life will all be a patient. And it's important for us to work together to provide you that best experience. And then the other aim that's been identified is cost. How do we provide more cost-effective care that's also efficient and keeps you healthy? Working in healthcare additionally is hard, and we haven't done a good job of taking care of our clinicians. So a fourth aim has been added, and now this is called the quadruple aim, because unfortunately we have high rates of clinician burnout, depression, anxiety, and even suicide. In our first year of delivering collaborative care, the reason I bring up the quadruple aim is because we hit all of these. We saw dramatic reductions in emergency department visits, hospitalizations, hemoglobin A1C, which is a type 2 diabetes indicator, and we saved millions of dollars. In addition, our clinic where we do this work has consistently scored second out of over 150 clinics in employee engagement. So if this is important and we should do it, why is it so hard? Well, there's lots of reasons why it's challenging, and I'm going to briefly talk about two that really make the work hard. And the first is the business of healthcare. So say you go to McDonald's and you order a Big Mac. The Big Mac you get at the McDonald's you're at, or a location a few miles away or one across the country, is pretty much the same Big Mac. But when you enter a clinic or a hospital, the composition of services at that facility are different. You have different healthcare providers. For example, you might have a pharmacy on site and you might not. There's not uniformity in how healthcare services are comprised, and so it's difficult to take one model and just plug it into somewhere else. In addition, you can't get your Big Mac unless you can pay for it. And you know what the price is. In healthcare, we don't have good price transparency about what we're paying, and sometimes we don't know what the cost is going to be based on the illness or situation. In addition, healthcare systems have to deliver care to people that can and those that can't provide care. All these complexities make it difficult to change the system. The other challenge we have is how we educate health profession students. And the best way I know to describe this is using the Lego movie. So if you've seen the Lego movie, you know that there's this character named Emmett, and he's like this regular guy, kind of like me, a regular person that fell into this circumstance. And there's a part in the movie where they're pretty despondent, and he's with all these master builders, and they're really great at what they do. And he says to them, "You guys are all so talented, and you know what you're doing, you're master builders, but your problem is you don't know how to work together." It's exactly the problem we have in health professions education. In today's world, we graduate great pharmacists, nurses, physicians, but we haven't taught them how to work together, and then we put them in the clinical environment and expect it to just happen. Well, I can tell you it doesn't. And then Emmett wisely says this in the movie, "When I had a plan, I could really do great things." And that's what we need to teach our health profession students to do, to work together and come up with plans with patients to help optimize our healthcare system. So I want to leave you today with 6 lessons that I've learned in this experience that I hope you can take with you to make the world a better place in healthcare or whatever industry you work. And I'd like to tell you that changing a system begins with changing yourself. And if you can change yourself and what you know and how you act, you can begin to change the world and make it better. So here are my 6 lessons that I've learned as Alice in Wonderland. The first is grit. If you don't have grit and are willing to take on challenges and face things that are going to be difficult, this work is not for you. It's tough, it's not easy. The second one is don't listen to no. And this is something I love about Alice in Wonderland. How many times was she told not to go down the rabbit hole or listen to these characters that she did? There's going to be everyone that tells you you can't do what you're doing. It won't work. It's impossible. You'll never make a change. Don't listen to no. It's very important. The next lesson is to get over yourself. Because guess what? You're not God's gift to the world. And that means you either ego down, admit I'm not God's gift, or you ego up. And in my case on a healthcare team, I have to ego up because I'm trained as an occupational therapist. And occupational therapists help people with disabilities and disorders engage in activities that are meaningful, things they choose to occupy their time. In the medical model, my delivery of care is prescribed by a physician. And when I was trained to be subservient to physicians. that I wasn't really supposed to bring my voice to the table. So when I come to the healthcare team, I have to ego up and say what I'm doing with the patient matters, and the whole team needs to know it. The next lesson is to promote what's called psychological safety. Dr. Amy Edmondson has studied this extensively, and psychological safety happens in high-performing teams because people are allowed to speak up and engage without threat. You can say something and have a different opinion without consequence, without penalty. It's easy to talk about and hard to do. And so that gets to the next lesson, define your culture. And in our clinic, we defined our culture of psychological safety with 2 mottos. The first is, everyone teaches, everyone learns. When we believe that from the front desk to our patients, to our families, to our physicians, that we can all teach each other something and learn from one another, we democratize our team and we recognize that we all bring value. And that's very important to help cultivate collaboration. The second lesson, or the second motto, is assume positive intent. Instead of viewing people with different opinions or different ideas as against you or not with the idea you have, when you reframe it and think that everyone's here for the betterment of the patient, and we assume everyone's got that same goal, we can work together much more effectively. And these 2 models have really shaped that culture of collaboration. And I encourage you to take those, especially assume positive intent. It applies everywhere, not just in healthcare. The last and probably most difficult lesson, the most painful one, is that you have to know yourself and know yourself really well. And that means knowing your strengths on a team, but also your weaknesses. And often you get to know yourself through self-assessment. So our team did a self-assessment on conflict engagement, and I scored 100% accommodating. So later you can come to my office and I'll give you whatever you want. It explains a lot about how I function on my team and my marriage, but it's also important for me to know. And it's also embarrassing, frankly, to admit that you might have one way that might negatively affect the rest of your team. But if you don't own that and aren't willing to become humble and recognize the impact of that, you'll never make progress on a team. And so even though it's painful, it's very important. So as I come to a close, I want to challenge you. Will you be like Alice and go down the rabbit hole? I can tell you 4 years ago, I knew basically nothing about what I'm doing today. I have learned so much, and it takes taking that leap and going down the rabbit hole. And I'm going to tell you, you don't have to know anything and everything about the topic, but you have to be willing to put yourself out there and try to do the things that will make the change. But I will leave you with this advice. You can be Alice, but don't go at it alone. Because I've learned that we're better when we have different perspectives and different people at the table. And please remember that to change healthcare, we have to do it together, and we are better together. Thank you.
So in wrapping up this training module, it is important to identify what you have learned to determine how you will use this knowledge. You've learned the definitions, reasons behind, and principles of interprofessional education and interprofessional practice. You've reviewed the social work competencies, nursing essentials, and interprofessional educational collaborative competencies, and applied these to a team-based care case study. You've gained a comprehensive interprofessional education lesson plan for nursing and social work students. And we have reviewed additional pedagogical tools that can be used with healthcare students from across disciplines. We hope that you have found this training module helpful. This slide identifies the references that we have used throughout the training module. And finally, our last slide leaves you with several hands-on resources that can be helpful in developing and delivering interprofessional education to your healthcare students. Thank you.